We're talking about the frontal lobe today, and we're going to dive in. We're going to dive straight in. If it's your first time here, my name is Lily. I'm a neurologic physical therapist, and in this channel and in my Instagram and the podcast, I simplify neuro concept because neuro can be so complex and feel like a gray fog, like people get scared of neuro sometimes, and I'm here to make it simple and make it click fast. So we're going to dive into the frontal lobe with a particular focus in the prefrontal cortex. Okay, so we're going to dive into and connect it to what's the TBI topics. Okay, so the frontal lobe, it's very complex because I feel like in the frontal lobe there's like many different lobes inside the frontal lobe, and so when we think about frontal lobe, we automatically think about cognition, right? And like behavior and all of those things. But it's more than that, right? There's so many other areas that we might not know, or we might know and we're just not aware of the deep or the depth of those functions. So the frontal lobe, you're going to see, of course, the primary motor cortex, right? So you can see here, primary motor cortex, and we see supplementary motor areas, premotor cortex. This is where mirror neurons happily live. We see Broca's area right here in purple. We see different parts of what make up the prefrontal cortex. Okay, so the prefrontal cortex, we see this when we're studying the Parkinson's topics, because in the Parkinson's topics, we see involvement of the dorsolateral prefrontal cortex, okay? But we're gonna also mention the frontal eye fields. I've mentioned this in another video. The frontal eye fields are supplied by the MCA artery, and the frontal eye fields, basically, the function is to direct our eyes contralaterally, like in a horizontal movement. Okay, so if my left eye, the frontal eye fields are going to shift my left eye to the right, and then vice versa. Okay, so when we have a stroke, this is not going to work. So the eyes are going to stay on the same side of the stroke. Okay, so that is the frontal eye fields. We're going to dive into the prefrontal cortex. Okay, so the prefrontal cortex, it's composed of different things. First, we're going to talk about the orbitofrontal prefrontal cortex, then which is right here. You can see it right there. We have I didn't put on the diagram what's called the anterior cingulate cortex, or the medial prefrontal cortex, because probably it's deeper, right? And then we have the dorsolateral prefrontal cortex. Okay, so let's start with the orbitofrontal prefrontal cortex. Now, if you Google Phineas Gage, this was a railroad worker that he was trying to, he was working on the railroad, and somehow he was using a rod to do something on the railroad. I don't remember the specific story because it's been a while since I've covered this. I usually covered it completely when I'm teaching Neuroanatomy Simplified, which is a workshop that I have on neuroanatomy. But basically, Phineas Gage was a very young male who the rod that he was using to do some holes in the railroad exploded. He put the iron into something inside as he was working, and the rod exploded and it perforated. It went through his cheek, and then it went all the way out the opposite side at the top of his head, and it perforated his frontal lobe. Okay, so after this happened, Phineas survived. He lost his vision because it went through his cheek and damaged the eye and the nerve, etc. after this happened, and after he was out of the hospital, people started to kind of like see Phineas behave a little differently. He was impulsive, he was inappropriate, his behavior was just odd, okay? So that's why I call Phineas Gage as the world most famous traumatic brain injury, okay? This was a traumatic brain injury, okay? So Phineas was a bit impulsive, inappropriate, lack of judgment, etc. So his main area damage in the prefrontal cortex was the orbitofrontal prefrontal cortex. Okay, so here I'm going to put, so you can remember, Phineas Gage. Okay, now how do I remember this? You're going to laugh, but so remember the luxury brand Gucci. Okay, so it's like Gucci, but Gagey, Gucci. Okay, and imagine Phineas using some Gucci sunglasses, so we're like orbits. Okay, so I'm gonna draw Phineas without his eye, and he was using, what's the Gucci logo? I forgot. Is it like something like this? I don't remember. Using the orbits, Gucci orbits. So Gucci, okay, orbits. To help you remember, orbitofrontal, meaning this is a frontal lobe personality, impulsivity, lack of judgment, inappropriate. This is what you kind of like think about when you are thinking about Rancho 4, right? And so these are, of course, ways that you can remember. These are not exactly like, oh, orbitofrontal causes Rancho 4. No. This is just ways so you can remember. So orbitofrontal, prefrontal cortex, Gage, Gucci, orbits, okay? Then we have the dorsolateral prefrontal cortex. So the dorsolateral prefrontal cortex, this one has to do with executive function. Okay, executive function. When you think about executive function in frontal lobe, you are basically thinking about the dorsolateral prefrontal cortex. Okay, so this one is going to cause deficits with working memory, planning, attention, sequencing, dual tasking, executive function. And remember, executive function, another way to call executive function is working memory. Okay, working memory equals executive function. Let me zoom out because this one, there we go, equals executive function. Okay, so dorsolateral prefrontal cortex, executive function, think clock test, working memory, learning rules, planning, attention, sequencing, meaning, CEO, vibes. Okay, dorsolateral prefrontal cortex. And the last one is going to be the medial prefrontal cortex. The medial prefrontal cortex, usually we don't see it mentioned a lot, but the medial prefrontal cortex, also called the anterior cingulate cortex, this one is involved in a lot of psychiatric disorders. It has to do a lot with motivation. You will see patients with apathy, lack of initiation, all of that. So medial prefrontal cortex, decreased motivation, apathy, decreased initiation. So very commonly involved in a variety of psychiatric disorders. Okay, so psych. Okay, all right, so recap. Prefrontal cortex, three main areas. We have orbitofrontal prefrontal cortex, think Phineas Gage, Gucci orbits, Gagey orbits, okay? Meaning you're going to remember Phineas Gage, impulsive, inappropriate, lack of judgment, frontal lobe personality. Then we have the dorsolateral prefrontal cortex, which we're going to think executive function, working memory, sequencing, attention, dual task. Okay. So if there's a case that tells you your patient has trouble with attention sequencing, dual tasking, etc., or you're implementing a clock test, which area of the frontal cortex you are assessing, it's going to be the dorsolateral prefrontal cortex. Okay. Lastly, we have the medial or anterior cingulate cortex. This one has to do with motivation behind attention. If your patient has a lesion here, we're going to see lack of initiation, lack of motivation, apathy, etc. Very involved in psychiatric disorders. All right. Okay, everyone. Thank you so much for watching. Feel free to subscribe, share this with your friends, and I hope to see you next time. Bye.